Okay, we're going to look at a nice little strength builder for the hip and activation exercise here. This is a standing isometric hip abduction exercise. So the real target is over on this side here. If you begin standing with your feet slightly wider than shoulder width apart, and so that your shoulder is just kind of touching against the wall, and you can kind of lean in and get your hip to touch the wall as well, then you can take this inside leg, bring it up into as much hip flexion as you can control actively. Now we're using the surface of that thigh and this shoulder to push into the wall, and we just try to get real strong into the floor with this foot on this side. So we're just pushing hard into the ground, like we're gonna crack a hole in the ground with our whole foot, and then trying to kind of drive that foot out and away from the wall in order to push harder into this wall. And really, if you bring your mind into how strongly can I push into this wall and sort of distribute that contact from the shoulder down to the hip, that's going to get us a very powerful contraction in this muscle here. So when we're exercising with that, we want to take a breath in and use a tension exhale. So during that kind of forced exhale, you're going to try to generate as much power as possible, and that's going to help you to really just kind of concentrate on increasing your effort level to during the course of that, like 3 to 5 seconds as you're exhaling, okay? So we'll usually do something like 5 to 8 reps of that, or we want to be strengthening in that position for somewhere between 20 and 40 seconds. Okay, so that's our isometric hip abduction versus the wall in standing. And a great way to build some strength into a hip, and we're often going to use that with our rehab clients when things are a little sore or grumpy around that hip, to find a way to help begin getting that area to be healthy again and build back some strength, and maybe take down some tenderness that could be in the tendons there around your glute muscles and stuff like that. Okay, so that's it, and I hope it helps.